Thank you ever so much for that brilliant introduction, Catherine. So I'm here today to, as Catherine said, highlight some of the findings from our first report from our research project on responses to household food insecurity in the UK during the COVID-19 outbreak. So just for your sort of future reference, I guess, or if you can click on the links here, these are the links to both the project website itself, which gives you a bit more information about the project overall, and also to the funding stream. The project is funded by the Economic and Social Science Research Council through the UKRI's Rapid Response to COVID-19. I'm sure many of you will be aware of different projects funded through this stream, but there are lots of food, poverty and public health funded projects through it. So I would really suggest you have a quick look through and see if you can find any other projects that might be relevant to your practice work. Our project it started in July and it runs through to January 2022. The research team is made up of myself and Dr. Rachel Loopstra, who, if you work with evidence around food insecurity, I'm sure many of you will know her fantastic work. She's from King's College London. We're working also on the research team is Katie Gordon, who works in my department at the University of Sheffield, and also Professor Peter Jackson from the Department of Geography at the University of Sheffield. The project is very collaborative in nature, and we have two formal NGO partners who are working with us on it. Church Action on Poverty, who are helping us with some participatory panel, which I'll talk a bit about, and also Sustain, who again many of you will know, who are helping us with case study work working with their Food Poverty Alliance. So in terms of the background of the research, why we came to do it in collaboration with policy and practice and NGO partners, really was obviously the scale and complexity of the threats that COVID-19 posed to food insecurity in the UK, and the range and scale of responses that we saw really very quickly from the beginning of the pandemic. In terms of the overall aims of the project, there are four. So the first is to really map responses to food access challenges during COVID-19, which is obviously ongoing, developing and applying methods for monitoring and evaluation of those responses. The partners are also very interested in this idea of developing exit strategies to more sustainable food systems, and also informing future resiliency planning for future crises and different phases in the crises, as obviously we find ourselves at the current time. So just a quick overview of the project to give you some context of where what I'm talking about today. So I'm talking about the first pillar today, which was this national systems mapping. So I've mentioned a few times the project is UK-wide, so it is very much a comparative project across the 4 constituent countries of the UK. That's a really important defining part of the project. We're also launching a national food access system user panel. It's not a very catchy title, I'm afraid, but this is a nationwide panel of people who have experiences of accessing support with food during the crisis, and that's what we're launching with CAP. And thirdly, local case study systems mapping as well, which will involve in-depth case studies in several local authority areas across the UK, across the 4 countries. So I'm talking today about the nationwide mapping work that we did, and this is the report, and you can access this at the link there. So I'm just going to present a couple of key findings. In terms of how we did this mapping, just to give you context, the mapping methodology really involved systematically searching and analysing publicly available information on the responses between March and July. So it's very much focused on the national lockdown period. These findings were what we've said is sense checked at workshops with national policy and NGO stakeholders in each country. So we did one for England, one Wales, one Scotland and one for Northern Ireland. And the report was also reviewed by several stakeholders. So we consider this work very much live. So if anyone here sees anything that we've missed or should include, please do drop me a line, because we very much see and welcome comments and corrections as we go on. So the key topics I'm going to talk about for the rest of my talk are the threats that were apparent to household food security during the pandemic, and the responses that we saw across the 4 constituent countries of the UK, pointing out some key similarities and differences, focusing in particular on 5 key interventions. And hopefully it should complement particularly Sharon's presentation around some of the policy that Sharon mentioned earlier. So in terms of the threats to food insecurity then, we actually, at the beginning of the mapping, we went right back to sort of the FAO's very underlying definition of food security, and they have 4 different dimensions of food security. And what we did was we actually sort of mapped the threats that were apparent during the COVID-19 outbreak onto these. And this slide really shows you just how significant the threats to household food insecurity were right from the beginning of the pandemic. So in terms of impacts on household food access, this first dimension here, obviously threats to economic access around income loss through unemployment, self-isolation and shielding, physical access to food in terms of the extremely clinically vulnerable not being able to go out to purchase food, and also people at moderate risk avoiding going out to purchase food as well. The second pillar relates to impacts on the availability of food for individual or household consumption, and obviously everyone will remember the shortages in food shops, but also food project interruptions in terms of supplies of food, social distancing requirements, and volunteers having to stay home being a big issue in terms of the capacity of projects to continue to offer support. The closure of institutional food locations, obviously schools, but also other kind of care facilities, the closure of cafes and restaurants, and some food markets as well. And in terms of the impacts on the stability of household food supplies, then in the early weeks, as I've mentioned, the interruptions in supplies in supermarkets being key here, and also interruptions in operational hours of food projects, for example, food banks, and really the changing food purchasing and eating patterns that we saw across households in the country, changing the regularity of food purchasing and food acquisition. And this obviously all has impacts on individuals' utilisation of food, so diets being potentially less diverse depending on what people could access at the time, access to specialised diets being compromised. There are obviously concerns for food safety in homes, and just the impact of general altered food practices as well over this time. And really importantly as well for health, overlaps of clinical risk to complications of COVID-19 with nutritional vulnerability similarly. So actually Sharon mentioned the Food Foundation's YouGov polling work, and Rachel Loopster has done some analysis of these from the 3 first waves of this survey. And so I'm going to show you just a quick slide in this in terms of the impact that we did see the COVID-19 lockdown having on crisis and lockdown having on food insecurity. So just to note here quickly that the recall periods were for 3 waves. So in April, the recall period was between lockdown and early April. The second period was between Easter and May. And the third was early July since the beginning of June. So you can see from this slide here, the sharp rise in food insecurity during the COVID-19 outbreak compared to the findings from the 2018 Food and New data. So you can see there the orange one being the early first few weeks of lockdown, and whilst it came down in the second and third wave, still significantly more than we found in 2018. And it's important to highlight as well that, consistent with Food and New findings from 2018, vulnerability to food insecurity since the lockdown, those vulnerability factors were the same. So younger age groups were at higher odds of food insecurity, non-white ethnicities, households with children, people with disabilities, and those unemployed, all at higher odds of food insecurity. Those retired still at lower odds of food insecurity comparatively. So it's really the first kind of response that I'm going to talk about here is obviously retail supply chains, and the fact that we, as I said, can all remember the empty shops and the pictures of empty shops as well. And actually the findings of the Food Foundation survey highlight just how important this was as a factor of food insecurity during lockdown. So actually the Food Foundation analysis highlights that about 40% of food insecurity in the sample in early lockdown was in fact explained by lack of access to food in shops. So whilst this was adjusted through supply chain mechanisms and things evened out after the first few weeks, we really mustn't forget these early weeks of the crisis and what they exposed about the food systems. For example, the vulnerabilities embedded in just-in-time supply chains struggling to keep up. And not just the impact on individual consumers and households, but also on food, charity and other food systems as well, in terms of the ability of, say, food banks to get their food supplies. And at the same time, we also mustn't forget the ongoing threats and issues posed by the global pandemic. So, and when we talk globally as well, thinking about the impacts on harvesting and planting, the impacts on food manufacturing capacity and capabilities, and also looking forward to further policy changes, the impact of Brexit and COVID-19 combined. So whilst the retail market really adjusted in response to supply and availability issues in shops, policy and practice responses really focused on economic and physical household barriers and alternatives to food previously available through institutions such as schools, services or community settings. There were a number of key groups that policy responses in particular focused on, and it's just worth highlighting which ones these were. So they were the extremely clinically vulnerable who were asked to shield and stay at home, those who were so-called moderately clinically vulnerable who were asked to limit their contact outside the home, but those so-called non-shielding vulnerable, and those who could not afford to access food but could leave their home, so financially vulnerable. Overall, the responses to these food access barriers have been on a scale and complexity not seen in recent times in the UK. The responses to risks of food insecurity came from all sectors, government, private, voluntary sector, and at all levels. That's really striking, local, community level, national and UK wide. They've been funded by both new funds and existing funds which have targeted particular groups in a way, again, that we've just not seen before in recent times. And the voluntary food aid sector has played a particularly prominent role in responding to economic vulnerability to food insecurity throughout the crisis. And this slide is just really designed to kind of highlight the extent of the scale and breadth of response. So as I said, you've got all levels of government, third sector and from various sectors of food, poverty and health, businesses, food retailers, school food caterers, local communities in terms of product adaptation and local coordination, and of course neighbourhoods, friends and family. As a comparative UK project, it's really important to highlight the governance layers involved in this, and we really need to be mindful at all times of the importance and significance of this. So with aspects of devolution and particular policy areas being very relevant here around food, health and aspects of social policy, meaning that devolved governments play an incredibly important role in this, and then select Whitehall departments with remit over England. But also, so nationwide, some nationwide interventions have been significant around the furlough scheme, for example, but there are obviously key differences in delivery and implementation, particularly in Scotland and Northern Ireland. The local authority level has been pivotal. That was apparent right from the beginning of this research. So even where funding or policies are developed at a devolved or UK level, implementation has often been at a local authority level. So just quickly, I'm going to just run through some of the key schemes. The shielding box scheme that Sharon's already mentioned, school food replacements, state financial protection, emergency financial and food assistance, and retailer adaptations. So in terms of the shielding food boxes then, all 4 nations ran a version of a shielding box scheme, and in England, Wales and Northern Ireland. So the key difference here with Northern Ireland being that the boxes were available for those who were financially vulnerable. And in Wales, they ran for a couple of weeks longer than in the other schemes as well. The Scottish, there's been an evaluation of the Scottish scheme, which is actually very interesting, and that highlights that those who were more likely to receive food boxes were aged younger than 65, living alone, socially economically more vulnerable, unemployed or not working because of a long-term condition or disability, or they were caring for someone else. Of the 19% of respondents who have received home delivery of free food boxes but no other support, 25% said they would have struggled to access food without the food boxes. And among those who signed up for food, for the free food boxes and a priority online delivery slot scheme that they ran in Scotland, 51% did so because there were items that they couldn't get via the free boxes, and a quarter wanted to make sure they definitely wouldn't go out without food. So this really highlights issues that Sharon's already brought to the fore there around the nutritional content of food, the suitability and tailoring of those food boxes, and also the lack of social aspects as well. So the free school meal replacements, obviously Northern Ireland stands out very much in terms of the direct payment of families, the direct payment to families in receipt of free school meals. None of the other countries did that straight off the bat. Obviously England had, for those of you who are familiar in this space, England had particular problems with their national voucher scheme. And the research that's coming out from key NGOs such as CPAG really highlighted the importance of cash first responses for families being seen as much more appropriate, safer, and more effective from a family perspective. So I won't talk in detail about these as I've not got time, but these are just some of the national scale UK-wide interventions that were significant for state financial protection. And obviously some of these, as these change, there are some key questions for economic access to food, particularly with the close of the job retention scheme and short-term support as well. So Rachel's latest analysis also highlights the importance of the furlough scheme to protect people from a major rise in food insecurity. So this report, I've got a link at the end, this analysis really highlight that the rates of food insecurity among the newly unemployed are extremely high at 18.5% compared to 7.4% among people who remained in employment, and 10.2% amongst adults on furlough. So furlough did have a protective role to play. So there are big questions about what will happen next. In terms of emergency payment schemes, Sharon mentioned the living expenses support in Northern Ireland. The big stark difference here across the 4 countries is that England has no national emergency payment scheme. Local authorities administer local welfare assistance schemes that they run and manage themselves, but they're not required to be cash-based, and there isn't any national oversight, which obviously compares starkly to the other 3 countries. Although interestingly, the Poverty and Equality Commission in Scotland has already published some reflections on how the Scottish Welfare Fund was used over the lockdown period, and they highlight that it wasn't utilised to the extent that they would have expected it to be, and highlighted a number of key challenges that they identified over that period. So a lack of knowledge and awareness of the fund by people who might have needed to access it, variation in how local authorities promoted the fund, barriers to applying, particularly online applications or busy phone lines. There was an apparent suspension of the community care grant, which was an additional fund that people could have used, and the local authorities just not having the resources to properly administer the fund during the crisis. So it'd be interesting to see how those kind of findings compare to the other 2 nations that held similar schemes. And in terms of charitable emergency food assistance, we've heard in both the previous presentations the incredible work that's gone into adapting community provision for food. So there was seemingly big changes in the landscape of provision. So both on the one hand, the closure of community or social eating projects, cafes and lunch clubs. Some of this was reworked into food aid, but also new food aid projects coming up, whether they be chill cooked for people to eat at home or ambient food parcels. And then on the other hand, you have big adaptations made to existing projects. Obviously, I've put Trust for Trust food banks here as an example, but all food banks, everyone had to adapt to COVID guidance and challenges around volunteer capacity. And that might have involved doing more delivery, for example. Also increases or newly introducing self or electronic referral processes where people couldn't have face-to-face meetings with referral agencies, for example. And changes to supply and operations, so different kinds of funding, be that government funding, private industry funding, different kinds of public donations, so more financial donations from the public, less food or in-kind donations maybe. And in-kind support, so for example, British Gas gave support and staff support to Trust for Trust food banks delivering food parcels in their vans, and new types of food sourcing. So Fair Share was mentioned earlier, so newly joining Fair Share or Tesco food donations through the Trust for Trust, for example. And obviously this all playing out distinctly in different places. So finally, just before I close then, the retailer options. The priority delivery slot scheme that was available across the UK, there were where retailers were working with different governments to make sure that certain slots were reserved for people in the vulnerable groups. They obviously made changes to shopping practices with delivery expansion and also different opening hours for different groups of people as well, to make sure that people could have time and space to shop. But also funding and donations in kind to voluntary sector projects, both financial and in kind. So the desk-based work we did earlier in the summer, which won't have uncovered every donation, but even just our desk-based work highlighted that by our count there was at least £49.5 million donated in kind or financially by retailers to the food support voluntary sector. So these are on the slide for you to have after this presentation, but these are the links to Rachel's 2 reports, and obviously I've linked the report as well earlier in the slide. So please do go away, and any questions I'd be glad to answer them. Thank you very much.